Okay, I think it's time for our class. Class begins. Good morning, students. Sit down, please. Well, we are having this class ritual just to wake you up, since we know that you have students don't have breakfast. Still, the students have bread, drink milk. Before class it's okay, but now class begins. Okay? Please pay attention to the lecture. Okay? Today we are going to give you 3 lessons about increased ICP and brain tumor. And still we have another teacher to give you lessons on brain trauma. But the first 3 lessons is about increased ICP and brain trauma. As a class, for MD student, I think you are very smart. Okay, you are elite student. So just to read a book to you is not enough. It's not appropriate. So I insist on give a lesson in English. And I summarize the contents in a slide. So I would like to give you some vivid picture to help you understand the lecture. Okay, so if you concentrate on my lecture, so I think you can grasp the most important part of these 2 lessons. Okay, you don't have to look at the book and you just listen. And then afterwards, after class, you can check the content on your textbook. That's enough, I think. The first lesson is about brain. How to next 鼠标怎么弄？我跟你说。Okay. So first I would like to give you a very brief introduction of neurosurgery. Neurosurgery is a discipline of medicine, and that specialty of surgery which provides the operative and non-operative management, that is prevention, diagnosis, evaluation, treatment, critical care and rehabilitation of disorders of the central, peripheral and autonomic nervous system, including their supporting structure and vascular supply. The evaluation and treatment of pathological process which modify the function or activity of the nervous system, including the hypothesis. So the neurosurgery really deals with a broad spectrum of disease, not just clinical work, but also we do some research work. The lesson is about intracranial hypertension. We have, clinically we have some synonyms. Increased intracranial pressure, increased ICP. These words can be used interchangeably. So remember, intracranial hypertension, increased intracranial pressure or increased ICP, the same meaning. Okay? So remember it. Pathophysiology of increased ICP. How the intracranial pressure maintained and why they are increased. So we know from our anatomy study that intracranial components consist of 3 main parts: brain tissue, cerebrospinal fluid, and blood. In the pathological condition, a mass, no matter what is a tumor, a trauma, a hematoma, or any malformation, we call them a mass. If there a mass occurs, of course, intracranial pressure will be high. Okay. Some proper names. Intracranial hypertension. Before we talk about it, we should know what is intracranial pressure. Intracranial pressure means brain pressure, Or we can measure CSF pressure or intracranial cavity pressure. How to obtain intracranial pressure? We usually obtain intracranial pressure through the lumbar puncture. Okay, we ask the patient lie down and do the lumbar puncture and measure the intracranial pressure. This kind of intracranial pressure actually is a CSF pressure, right? CS pressure equals to brain pressure equals to intracranial pressure. They are the same. Okay. The normal value, we have to remember, CS pressure or intracranial pressure, in adults, it's about 70 to 100 millimeter water. Okay, not mercury. In adult, 7 to 200 millimeter water. For children, it's almost half lower, 50 to 100 millimeter. In any case, if we measure the patient's intracranial pressure or CS pressure greater than 200 millimeter, it's called increased intracranial pressure. Okay, it's quite easy. So remember, if it's greater than 200 millimeter, it's increased ICP. So quite easy. Remember the value. In normal condition for adults, from 70 to 200 millimeter. For children, it's only 50 to 100. Okay. So, as I have told you that for the pathophysiology of increased ICP, usually there is a compensation mechanism work in the intracranial for the intracranial components. We have told you that three main parts: brain, parenchyma, brain tissue, CSF, and blood. For brain tissue, brain parenchyma, which cannot be compressed, okay, it works fundamental function. If it is compressed, then neurological deficits will be occur. Okay. For CSF, there is a secretion and absorption dynamics. So if there is a balance between secretion and absorption, then the intracranial pressure can be maintained at normal limit. Okay? If there's something malfunction, over secretion or less absorption, then the intracranial pressure will be higher. Okay, it's quite easy to understand. And blood for blood, when the construction of vascular bed, blood volume shrink, then intracranial pressure will be get less. Okay, if there's a construction of the congestion of the blood vessel, blood volume in the brain, then the intracranial pressure will be higher. So within the normal blood limit, there is an auto-regulation of cerebral blood flow. Okay, the human being has been operated quite wisely by a bone mechanism. Auto-regulation of cerebral blood flow. For cerebral blood flow is in proportion to perfusion pressure. Cerebral perfusion pressure, CPP, cerebral perfusion pressure, which almost equal to blood pressure. As we told you that ICP is just measured with water. Okay, it's less than 200 millimeter water, but blood pressure is measured as mercury. Okay, so in that case, intracranial pressure can be neglected. So perfusion pressure almost equal to blood pressure. So CBF is in proportion to blood pressure and in constant proportion to cerebral vascular resistance. Okay, if the autoregulation breaks down, the cerebral blood flow will get less greatly. So remember this equation. In which case, the intracranial pressure will be happened. So we talk about etiology. The first one is intracranial space-occupying lesion, NMS. Okay, space-occupied lesion is quite a vague name, so it equals a lot of diseases. Number two is increased brain volume. We call the brain edema, a condition most frequently occurred in pathological diseases. Number three is imbalance of CS secretion absorption. Number four is decreased cranial cavity in case of depressed fracture. Number five is increased cerebral blood flow and venous pressure, which cause congestion. So I talked about separately. This picture shows there is a space-occupied lesion on the right temporal lobe. You see it's very clear. The mass is here, is a space-occupied lesion. At first we don't know what's the disease or what's it. So we just call it a space-occupied lesion. It compresses ventricle and causes a shift of midline. Okay, so this is space-occupied lesion. If this happened, of course, intracranial pressure will be high. Okay, we measure the when we do the lumbar puncture, we measure the intracranial pressure for this patient. Definitely, it should be over 200 millimeter water. Okay. Maybe 400 or 500, very high. This is an intracranial space-occupied lesion. Okay, it's quite easy to understand. Increased brain volume. Brain volume, we call it edema. No other mass or no other neoplasm happened, but the volume of brain increased. When it gets swelling, then the brain itself gets swelling. We call it edema. In this case, there's an infarction right here on the frontal lobe here, and the brain is edema, in condition of edema, so the pressure is high, should be. This is an imbalance of CS secretion and absorption. We see the enlargement of ventricle. There are lots of CS accumulation in the ventricle system. So the doctor this is a tube. This is a tube we inserted. We do the VP shunt or torsion shunt. We drain the excess CSF from the brain to peritoneal to abdomen. Okay. This is over secretion or absorption or blockage of the circulation of CSF. So this, when we remember this picture, we understand there's an imbalance of CSF secretion and absorption. Okay. And decreased intracranial volume, as we see in the depressed fracture or basilar invagination, etc. Increased cerebral blood flow and venous system. Okay, the number 4 is increased cerebral blood flow and venous pressure. So this is in case of AVM. This is AVM, and this is nodus of the AVM, and this is draining vein, very thick, very huge, drains to the sagittal sinus, superior sagittal sinus. During brain, we can see this, like this. You can see on the surface, on the cortex of the brain, you can see the AVM. In that case, the intracranial pressure will be get high. Okay, so I just mentioned five cases to help you understand why the intracranial pressure can get high. Another picture is very important, intracranial pressure volume curve. This mechanism just tell us why the intracranial pressure can be very critical, can be very dangerous. Okay, this x coordinates denoting the volume increase. This y coordinate denoting the increase of ICP. Okay, well, if we have some mathematical basis knowledge, we can quite easily understand this picture. So that means during certain condition, the increase of intracranial pressure, intracranial volume, just lead to a minimum, a very little amount of intracranial pressure. Okay? But when we reach some very critical point, only very little, just 1 milliliter volume increasing will get very sharp increase of intracranial pressure. Okay? So for a person, when the patient consults the doctor, we don't know in which state the patient's intracranial pressure remains. So if in this area, when the increased volume of brain increase, just get a very little change of ICP. But during this area, if only just a very small amount of increase in volume will lead to huge, sharp increase of intracranial pressure. In that case, will cause what? Will cause herniation, intracranial. We will talk about later the crisis of intracranial pressure. That's herniation. Okay. So for a doctor, you have to understand when you walk in the emergency room, when a patient comes, you have to know that only maybe only 5 minutes ago the patient can talk to you, she's alert, but only a few minutes later the patient may get into coma or even herniation. So this is a very dangerous situation. So some kind of complaint for the malpractice doctor, simply because the doctor don't understand this picture. Because you have to understand that when the patient have the trauma or have an emergency state, she can be changed very quickly. Okay, the patient's condition can be changed very quickly. Only a few minutes, the patient, he can walk to the emergency room, he walk to the emergency room, he can talk to you, but when he leave the emergency room, she will just fall down and get coma. So for such kind of process, patient don't know, but doctor should be know, should be well understand it's possible. Okay, so you have to pay great attention to such kind of cases. So as a medical student, I suggest you to memorize this picture. Okay, it's very important. In a certain stage, only very small increase of intracranial volume will lead to huge increase of ICP. Okay. For the clinical manifestation, still we can understand the patient will have intracranial pressure. They have some symptoms. So mainly we talk about a choice of increased ICP. Choice 3 means 3 frequency in the brain tumor. But in if it's occurred very acutely, we just see the first 2 symptoms. The patient will complain of headache, vomiting. Papillary edema, if it is a brain edema, it's occurred chronically, not acutely. We will see the papillary edema. Okay, so generally speaking, choice of increased ICP, 颅内液增高3联症 choice 3联症就 choice of increased ICP, headache, vomiting, and papillary edema. papilledema means 是乳头水肿. Papilledema, but it's not occurred in an acute state. Okay, if for a trauma patient, the increased ICP will occur only within few hours, so you cannot see the papilledema. But for a brain tumor, it's a chronic process, so we'll see papilledema. It's a good sign for increased ICP. Okay. And Cushing's reaction. For medical students, we frequently taught about Cushing. We mention the Cushing's name. It's an American neurosurgeon. She made a great contribution to modern neurosurgery. And also this reaction had been first described by Cushing. So in memory of him, we named the reaction as Cushing's reaction. 我们常讲 Cushing's 反应. What is Cushing's 反应? Increased in vital sign, increased disturbance in vital sign, that means increased ICP causes sharp elevation of BP, bradycardia, irregular respiratory rhythm. Most prominent when ICP increased severely and acutely. Okay, so if we give you a question, what is Cushing's reaction, you have to mention increased ICP causes sharp elevation of BP, bradycardia, irregular respiratory rhythm. So during our ICU, neurosurgical ICU, the nurse usually observe the patient to see whether the patient have Cushing's reaction. That means is there a sign of increased ICP? When the patient's BP, blood pressure getting high and heartbeat get lower, that's called bradycardia, then we have to be cautious that the patient may be in a state of increased ICP. Okay, so 3 kind of symptoms: elevation, bradycardia, irregular respiratory rhythm. Okay, Cushing's. Complication of increased ICP. So brain herniation. Brain herniation is a great concept. You have to understand what means brain herniation. When the ICP increase, get a critical point, as I mentioned in the picture, there's only a very small amount of brain volume increase, no matter whether it is due to blood, due to hemorrhage, due to swelling, due to edema, or due to necrotic of brain tumor tissue, that will cause an increase of brain volume. So when we reach a critical point, only a few milliliter volume increase of brain will get to a huge, sharp increase of ICP. So in that case, brain herniation will occur. So what is brain herniation? See. How to? Brain herniation is caused by a pressure gradient occur in cranial cavity. Okay, the transtentorial shift. We have transtentorial shifting and transforamen shifting. Two kinds. In case of transtentorial shifting, the uncus gyrus of temporal lobe herniated through tentorial incisula compressing the midbrain, oculomotor nerve, and PCA. PCA means posterior cerebellar artery. Okay. And transforamen shifting, the herniated cerebellar tonsillar compressing the medulla. Okay. These are two concepts of herniation. One is transtentorial shifting. The other is transforamen shifting. These are important. We talked separately. Tentorial herniation. Temporal uncus herniation, they are the same. Okay. Tentorial herniation, temporal uncus herniation, they are the same. They talk about the same thing. So you just to remember one. Manifestation. Okay. This picture shows us when the patient had a trauma and hematoma occurred epidurally. Okay. When the hematoma grow, it compress. What compress the temporal lobe? The inner part of the temporal lobe, we call it uncus gyrus. It's compress what? Compress the midbrain. So the nearby important structure like oculomotor nerve, PCA, have been compressed. Okay. In that case, the patient will have some manifestations. The patient definitely should lose consciousness. So, if the herniation occurs, the patient can't be conscious. So, loss of consciousness. Ipsilateral mydriasis, because the oculomotor nerve have been compressed. And also, patients who have contralateral hemiparesis or hemiplegia, according to the different degree of compression. So, in case of tentorial herniation, the patient should have three kind of manifestation: loss of consciousness, ipsilateral mydriasis, and contralateral hemiparesis. Okay, remember it. Remember it. The next is cerebellar tonsillar herniation. Its pathomechanism is just due to cerebellar tonsillar herniated into foramen magnum, which compress the medulla. And clinical manifestations are quite different from the herniation we talked right before. Cerebellar tonsillar herniation, the symptom is due to choice of increased ICP. Of course, we have changes in vital signs. And the most important thing you have to remember is sudden arrest of respiration. So I just told you that when a doctor in the emergency room, you have to be quite understand the mechanism of each patient will occur. Especially for a brain trauma patient, when they arrived with conscious and she can walk, but maybe a few minutes later, the patient may lose their conscious and sudden arrest of respiration. That cause death only just a few minutes later. So the change is quite dramatic. Okay, so when I was a neurosurgical resident, I also remember such kind of things. Let me tell you a story. Okay, that is almost 20 years ago. 20 years ago, when I was on duty in the emergency room, a young lady had been sent by ambulance to me. Okay. So when I check the patient, she can speak. She just compare headache. At that time, there no CT, no CT. When I check the patient, she can tell me what happened for her. So when I examine the patient, I feel the stiffness of the head. The patient, he can talk, but he's not very alert. So she just compared severe headache. So at that time, I think maybe when I check the patient, we find a hematoma in the occipital area. This is a sign that the patient maybe have a bone fracture of the occipital bone. So if there is a hematoma occurred, that will cause what? That will cause cerebellar tonsillar herniation. So I started very well. I'm quite alert for the patient. So I send the patient to the ward. I report to my senior doctor. See, there's such kind of patient. So I send the patient to the ward. So I come back to the emergency room. Only 1 hour later, when I deal with some consult for the patient, I have a spare time, I will go to the ward. I just see what happened. The patient died. If I let a patient in my emergency room, that will be my responsibility for the patient, okay? So I send the patient to the operation, to the ward. When the doctor prepare for the operation for the patient suddenly have a sudden rest of respiration. So when the parents come, okay, when they come, the doctor told them the patient died. He totally unbelieved. He totally unbelieved. He said a word I remember quite well, even today. He said, 他是说中文说的了，我也是那种。怎么不可能呢？我们医生跟他说，他说病人死了，他说不可能的，3个G也没这么快。怎么1小时刚送来，怎么就马上死掉？送过来的时候还好的嘛，怎么就死掉了？所以这个故事呢 ，So this story, this is not a very sad story, even though for the patient suffer from hematoma in the occipital bone, okay, occipital lobe. So the hematoma compress the cerebellar tonsillar, which cause cerebral tonsillar herniation. It will cause sudden arrest of respiration. Very dangerous, very dangerous. So I told you the story just to remind you that neurosurgeon work in a very dangerous condition, okay? If you don't know what will happen, if you have no good prediction, they will make mistakes, okay? So what we learned today, actually will provide you some knowledge to understand the mechanism. The patient, the quick change of the patient, for the patient is possible, So remember it. In case of cerebellar tonsillar herniation, you have chance of increased ICP changes, vital signs, especially sudden arrest of respiration. Okay. ICP increase may also cause pulmonary edema. This is neurogenic in origin, increase in systemic outflow to the pulmonary vessels. Reactive high BP and peripheral constriction lead to overload of left ventricle, which with a shift of blood volume to right side of heart and lung. It's not so important. Digestive tract bleeding, ICP increase may also cause digestive tract bleeding. It's called Cushing's ulceration. Again, we mentioned the Cushing, the name of Cushing. This kind of ulceration is also named after Cushing, because the great neurosurgeon Cushing first described such kind of phenomenon. Increased ICP may cause a disorder of hypothalamic autonomic nervous system, so it causes ulceration in the digestive tract bleeding. Management. We talk little about management of increased ICP because this is not important for medical students. We try to make brain shrinkage. We use hyperosmic dehydrant like mannitol, diuretics, glucocorticoid. And the management of increased ICP, we use the method of decreased CSF volume. We make a CSF out drain or CSF shunt. Okay, the drug is not so effective. Measure of increased ICP, decreased cerebral metabolism. Use certain drugs, hypothermia, hyperventilation, and barbiturates. And operation. Okay, operation remains last, but most effective modality. Okay. It's the last resort for the patient, eliminating the mass effect we can. Internal decompression and external decompression. Internal decompression, we remove the hematoma trauma tissue. External decompression, we simply move the cranial bone flap. So still on the load, you may see some patients recover from surgery, they have the cranial bone defect. Sum up. For this lesson, we talked about what is normal ICP, the range of normal ICP. So you have to remember the value of ICP. It's from what? From what? I would like to your response. Okay, what is normal ICP? Huh? Louder, please. Louder. Huh? Normal ICP. The range of normal is from what? Okay. How about for a child? Okay. What means increased ICP? Over what? Over 200. Quite easy to remember. Okay. And also crisis of increased ICP. Herniation. What are two kind of herniation? One is tentorial herniation. What's the symptom of tentorial herniation? A loss of consciousness. Louder, please. I would like to have your response. What? Okay, you can speak in Chinese. That's okay. That depends on you. Yeah. 一次瞳孔变化的，一次瞳孔散大 ，ipsilateral mydriasis。Number 3。还有什么？偏瘫 ，contralateral hemiplegia, hemiparesis or hemiplegia. So when you have a filling test, you at least you should fill the blanks with these 3 parts: loss of conscious, ipsilateral mydriasis, and contralateral hemiplegia, hemiparesis. That's okay. And what is cerebellar tonsillar herniation? What's the difference? Change your Vatican sign. The most important thing. Yeah, maybe. Sudden arrest of the respiration. So that's it. Sudden arrest may have sudden arrest. You have to write it. Most important thing. If you write a lot of things, consciousness not so good, vital signs disturbance, but you lost the sudden arrest of respiration, then when you lose back. Okay. So you get the concept of herniation, 2 kind of herniation, and number 3, Cushing's reaction. What is Cushing's reaction? Yeah. In the case of increased hypertension, we have some change of vital sign. Elevation of blood pressure, bradycardia, and irregular respiration rhythm. Okay, so it's quite easy for this lesson. If you can remember all these things, that's okay. That's enough for you. Okay. I think time is up. Let's have a break for 10 minutes.